Physical diagnosis questions on cardiovascular assessment. First question. Which of the following is true about edema? I repeat, which of the following is true about edema? A. Interstitial tissue can absorb up to 10 liters of fluid, accommodating up to a 10% weight gain before pitting edema appears. B. Causes are rarely cardiac. C. Pulmonary hypertension frequently causes edema. Letter D. Dependent edema appears in the upper body parts. Which of the following is true about edema? Next question. Stage 1 hypertension for greater than or equal to 18 years of age to less than or equal to 60 years old. Stage 1 hypertension for greater than or equal to 18 years old to less than or equal to 60 years old. Letter A, 120 to 139 over 80 to 89 millimeter mercury. Letter B, 140 to 159 over 90 to 99 millimeter mercury. Letter C, 150 to 159 over 90 to 99 millimeter mercury. Or letter D, greater than or equal to 160 over greater than or equal to 100 millimeter mercury. So stage 1 hypertension for greater than or equal to 18 to less than or equal to 60 years old is. Next question. The following are correctly paired except. The following are correctly paired except. A. At or near the lower left sternal border is the pulmonic valve. Letter B. At and around the cardiac apex is the mitral valve. Letter C. Right and second interspace to the apex is the aortic valve. Letter D. Left second and third interspaces close to the sternum is the tricuspid valve. Letter E. None of the above. Letter F. Two of the above. The following are correctly paired except. Next question. In the event of the cardiac cycle, diastole is the period of. In the event of the cardiac cycle, diastole is the period of A. Ventricular contractions, B. Ventricular relaxation, letter C. Atrial contraction, or letter D. Atrial relaxation. In the event of the cardiac cycle, diastole is the period of. In ECG waves, the following are correctly paired except. In ECG waves, the following are correctly paired except. Letter A, S wave is the downward deflection following an R wave. Letter B, Q wave is the downward deflection from septal depolarization. Letter C, QRS complex is ventricular depolarization. And letter D, P wave is atrial repolarization. In ECG waves, the following are correctly paired except. Next question. This is difficulty of breathing that occurs when the patient is supine and improves when the patient sits up. Difficulty of breathing that occurs when the patient is supine and improves when the patient sits up. Letter A, dyspnea. Letter B, orthostatic hypertension. Letter C, orthopnea. Or letter D, PND. Difficulty of breathing that occurs when the patient is supine and improves when the patient sits up. Next question. The following are categorized as high cardiovascular risk for women except. The following are categorized as high cardiovascular risk for women except. Letter A, existing CHD. B, CVD. C, subclinical atherosclerosis. And letter D, DM. The following are categorized as high-risk cardiovascular risk for women except. Next question. Lifestyle modifications to prevent or manage hypertension. Lifestyle modifications to prevent or manage hypertension. Letter A. Regular aerobic exercise such as brisk walking, 3 to 4 times a week, averaging 40 minutes per session. B. Moderate alcohol consumption per day of less than or equal to 2 drinks for men and less than or equal to 1 drink for women. C. Optimal weight or BMI of 18.5 to 24.9 kilograms over meter squared. D. Intake of less than 6 grams of sodium chloride or 2 to 2.3 grams of sodium per day. E. All of the above. F. All except 1. Lifestyle modifications to prevent or manage hypertension. Next question. In assessing the carotid pulse, all of the following must be done except. In assessing the carotid pulse, all of the following must be done except. A. Palpate both carotid arteries at the same time to ensure accuracy of assessment. Palpate both carotid arteries at the same time to ensure accuracy of assessment. B. Press just inside the medial border of a relaxed SCM muscle. C. Avoid pressing on the carotid sinus. D. Slowly increase pressure until you feel a maximal pulsation. In assessing the carotid pulse, all of the following must be done except. Next question. In this condition, the rhythm of the pulse remains regular, but the force of the arterial pulse alternates because of irregular, strong, and weak ventricular contractions. The rhythm of the pulse remains regular, but the force of the arterial pulse alternates because of irregular, strong, and weak ventricular contractions. A. Paradoxical pulse. B. Pulsus alternans. C. Bigeminal pulse. Or D. Valsalva. Next question. A murmur-like sound arising from turbulent arterial blood flow is. A murmur-like sound arising from the turbulent arterial blood flow is A. Thrill, B. Brewy, C. Gibson murmur, D. Machinery-like murmur. A murmur-like sound arising from turbulent arterial blood flow is. Next question. Palpate impulses from the right ventricle in the right ventricular area normally at the. Palpate impulses from the right ventricle in the right ventricular area normally at the A. Lower right sternal border, B. Upper left sternal border, C. Mid-sternal level right, D. Subxiphoid area. Next question. Which of the following impulses is true about the apical impulse? A. Represents the brief early pulsation of the right ventricle as it moves anteriorly during contraction and contracts the chest wall. B. In most examinations, the apical impulse is the PMI. C. The apex beat is palpable in 60% of adults in the supine position. D. Aortic aneurysm will not produce a pulsation that is more prominent than the apex beat. Which of the following is true about the apical impulse? Next question. What is the best patient position to assess mitral stenosis? I repeat, best patient position to assess mitral stenosis. A. Supine position. B. Left lateral decubitus position. C. Dorsal recumbent position. Or D. Orthopneic position. Next question. Chest pain is one of the most serious of all patient complaints. The medical student knows that all of the following are correct about chest pain except. The medical student knows that all of the following are correct about chest pain except. A. Classic exertional pain, pressure or discomfort in the chest, shoulder, back, neck, or arm in angina pectoris is seen in 18% of patients with acute MI. B. Acute coronary syndrome is increasingly used to describe the clinical syndromes caused by acute myocardial ischemia. C. Anterior chest pain, often tearing or ripping, and rotating into the back or neck occurs in acute aortic dissection. D. If there are symptoms or signs of irregular heart action, obtain an ECG. E. None of the above. F. 2 of the above. The medical student knows that all of the following are correct about chest pain except. That ends our questions for today on the physical diagnosis of cardiovascular assessment. Please watch or wait for the answers for this video in our next lecture videos. Thank you. And that ends our questions.